Hi everyone, good evening. I'm Richa Sara, Editor-in-Chief Responsible Hospitals. Today I welcome all of you on an Insta Live session, and today's topic is all about PCOD. As you know, most of the women are going through from the simple problem which is called PCOD, and they have a lot of issues further in terms of expecting the baby, in terms of conceiving, and moreover much more which you might not be aware. So today we would be having our conversation with Dr. Aastha Dayal, who is a lead consultant, senior gynecologist and obstetrician with CK Birla Hospital, Gurgaon, and one of my favorite doctor too. So I hope in today's session you're gonna get a lot of insights, and I'm gonna add her soon. So Dr. Aastha, I'm just trying to send a request to you. Connect with me and we'll start the session soon. So guys, any of you, in case you are going through from a problem called PCOD, and if you want to know more what PCOD is and how it is affecting a body, and in case somebody who is near and closer to you would also be interested knowing this fact, I think this is the session you should be, checking out today, viewing it. If not now, maybe a little later, because it will be posted and published on Responsible Hospitals. So I want every one of you to make a note, to have most of the notes ready in case you have any further questions related to that. So Dr. Aastha, I've already sent a request for adding you. You need a good network place wherein we can start the discussion. I am waiting for you to, start the session. I'm just trying to add you once again. You might see my request, Dr. Aastha, and you just have to accept that. So guys, since she's here. Good evening,
Hi,
Dr. Aastha. How are you doing?
I'm good. How are you?
Good, good. So I was just introducing you that Dr. Aastha is a lead consultant, gynecology and obstetrician consultant with CK Birla Hospital, Gurgaon. And today we're going to talk about PCOD, which is a common issue, Dr. Aastha, and I'm sure many of the girls, women, they are facing this challenge of PCOD these days, and they hardly know much insights about it. So to start with, my first question to you is that what do you think? What is PCOD? People who are not even aware and they are new to this term.
So PCOD or polycystic ovarian disease actually means hormonal imbalance in layman terms. Uh,
Your voice is little slower. If you can just
is this okay? Am I audible now?
just a second.
Can you hear me?
I can hear you.
Yeah.
Yes, better.
Better?
Yes.
Is it better? I'll hold the camera then. Is it okay?
Yeah, your camera is fine, but the voice should be little louder. If you have earphones, you can even use them,
I don't have them handy. I'll try and speak a little louder.
or maybe little more near to the camera.
Okay, I'll be a little closer to the camera.
Somebody saying yes, we can hear, but not very clear.
Yeah, is this okay?
Guys, you can tell better. I am okay with it. Should be
So,
okay. Yes, we
should
can
be okay?
start.
Okay, so PCOD or polycystic ovarian disease actually means a hormonal imbalance. So female hormones, the ovaries produce some hormones which can go into imbalance, which can cause this problem. There are also some male hormones which are produced by our ovaries, which become excessive in PCOD, and there is another hormone called insulin, which digests the sugar. So all these three hormones can go into imbalance, which can cause PCOD or polycystic ovarian disease.
Okay. So, doctor, tell us, there are a lot of, the bodies are different. So, how do you think, how can we cure ourselves that you don't get into that disease? Is there any way wherein we can take those precautions, pele say that, you don't get into it?
Yeah, so PCOD does have a genetic tendency. As Asians, we are more prone to diabetes. So we are also a little more prone to PCOS than the Western population. And I've seen if we have a family history of diabetes or of thyroid, or if you have a person in the family who has PCOS, then of course you get more prone to it. But these are the things you don't have control over. But there is still a lot of role of lifestyle in PCOD. So if you are having
Yeah.
which means if you have a good diet, a good healthy level of exercise every day, and if you have a regular sleep pattern, you control your stress levels, then you can control PCOS to a huge extent.
Okay. So, what are the symptoms of PCOD, doctor?
So PCOD has a variety of symptoms. The commonest symptom is that girls can have irregular periods, which means they can have delayed periods. Instead of the period coming every month, sometimes the period comes once in 2 months or more than 45 days. The second thing that girls can have is excessive weight gain and difficulty in weight loss, which is a very common problem. A third common symptom, which is because of the excess of male hormones in the body, is a male pattern of hair in your body, which means hair growth around the belly button, around in the chest, around the breast, facial hair. That can be more in PCOS. Also acne. Acne also a male pattern of acne, which so in teenage girls acne is common, but if it persists after that, if you have it along the jawline, that is predictive of high male pattern this thing. And also sometimes hair loss in the male pattern is also a feature, and hair loss in the temples, like in a male pattern, like this, the two sides of your forehead, if they start having hair loss, that is a sign of male pattern. Besides this, in older, as you grow older, you realize sometimes you don't get any symptoms, but when you're trying for a pregnancy and you're not getting pregnant, then we realize that you have PCOD when we do your regular tests. Also, in your old age, if you have PCOS, you are more prone to getting diabetes, getting obesity, getting cholesterol. There is something called sleep apnea. That means if you go off to sleep, you don't get enough oxygen because your tongue falls back, and then you feel breathless at night and you wake up in the middle of the night. That is common. Also, your uterine lining becoming thick, which is called endometrial hyperplasia, is also common in PCOS.
Sure. And is it age specific? What is the earliest age you
Sorry,
realize that you
say that
can?
again.
I was asking that is it age specific or how early somebody can get it? What could be the initial
Yes.
age?
Okay, so PCOS is usually seen in the reproductive age group. Usually, it's commonly seen in girls in their 20s and 30s, but I've seen it even in very young girls when they start having their menstrual cycle from the age of 14, 15, and even in older women up till 40, 45, it starts troubling you. So, PCOS can happen in any age in the reproductive age group in women.
Okay. And any specific factors which affect PCOD?
Okay, so yeah, like I told you, there are two kinds of factors which affect PCOS. One is genetic, which we don't have control over, and one is the lifestyle. Lifestyle is something that we can control, and that includes factors like your diet. In fact, so I'm practicing in Gurgaon, and I see a lot of girls who were perfectly fine when they were in their hometowns, and when they come here for work or for staying and all, they develop PCOD because of the lifestyle. So it really changes. So if you have a night shift, or if you have a sleep pattern change, or if you gain weight because you're having a lot of junk food, you have a lot of eating options in metropolitan cities, then you have a lot of stress levels in jobs and all that can also affect your PCOS. So factors are basically your lifestyle, which is your diet, exercise, your sleep, your stress, and genetic factors which you don't have too much of control over.
Sure. One of the person Nandita is asking, ma'am, how can we reverse PCOD or PCOS?
Okay, so how can we reverse? So PCOS has, like I said, genetic factors which cannot be reversed. But of course, if you have a healthy lifestyle, which means if you have a good diet, and by a good diet, I mean you have to cut down on refined carbohydrates, which means all the things which are sweet, which means all the things which are generally sweets if you have, or desserts, or chocolates, or bakery items, and all the things which have maida in it, like biscuits, breads, pizza, burger, pasta, cold drinks, all these things which are mostly junk food that you have to avoid. And besides that, you also have to cut down on other other carbohydrates like rice and potato. So these things otherwise are healthy. But for PCOS, if you have excessive rice, excessive potato, excessive sweet potato, even if you're having a lot of sweet fruits like mango, chiku, grapes, banana, these are otherwise we say they're healthy fruits, but then they're sweet. So you have to limit that. So you have to cut down on the refined carbohydrates in your diet. Second thing, you have to exercise every day, which means about 30 to 45 minutes of cardio, which means anything which involves like aerobics or Zumba or a brisk walk or a jog, which can help you lose a little weight, and some weight training and some stretches like yoga and all. The third thing is a proper sleep. So you have to sleep for 8 hours at night. You have to eat at the right time. You have to sleep at the right time, and you have to control your stress levels. Because stress has a big role to play. It is very easy to say, but it's very difficult to control. And that is why people who go into yoga and meditation and Ayurveda, they can actually control their PCOS just by reducing their stress. And of course, there are medicines. There are a lot of people who do all this, but it's still not controlled. Then we need to give you medicines which can reverse your PCOS. But we don't like to give medicines throughout your life. So you should focus more on the lifestyle so that you need lesser medicines for PCOS.
Nicely answered. I think Nandita might have got her answer right. So, doctor, what are the risk factors? What could be the risk factors for people who are having PCOD, they are ignoring it, or let's say they are not actually focusing on it, on the
So,
treatment?
the risk factors are many. One is, see, obesity or acne or hair issues. Sometimes we look at it as a cosmetic problem, but it is actually also a health problem. So, obesity is a risk factor of a lot of lifestyle diseases like diabetes, blood pressure, cholesterol, cancers. So being obese is not good, and you should be controlling your PCOS if you are obese. So it will control both the things. If you control your weight, it also controls obesity and other problems related to PCOS. Second thing, the risk factors generally what we see is in younger age, maybe just irregular periods or irregular bleeding. Some body image issues can start happening like depression and stress and all. But as you grow older, sometimes girls get a difficulty in getting pregnant. So 30% of girls who have PCOS can have difficulty in getting pregnant. There could be some pregnancy complications as well. And later on in life, like I said, you could get diabetes and cholesterol and endometrial hyperplasia. So getting a period, not getting a period for 2 months, 3 months can cause your lining to become thick. And once that lining is thick, after the age of 40, if you get a thick lining, it is not healthy. And eventually it can also, an overgrown lining can also cause endometrial cancer. So all these things need to be controlled.
So basically, you are saying that as soon as you get it, they should be getting in touch with the doctor for the treatment.
So they should keep it in control. And so like we don't over control it. Like if a girl is getting her periods once in every 45 days, it's okay. So if you get 9 periods in 1 year, I don't need to treat you. But you should not be you should not be sitting at home if you're getting a period every 3 months. That's too late. So you should be not be ignoring those symptoms.
Okay. So with the medications, doctor, this can be cured. This is what you have been saying.
Yeah, so actually it is not cured totally, but it can be controlled with medication.
Okay. And then you can actually have a good pregnancy time and there is no problem in terms of conceiving.
So in pregnancy, again, you have to keep it in control. there are, as I said, some women do get a problem in getting pregnant, but only 30%. And if you control it well, you can get pregnant. But of course, in pregnancy, there is a higher chance of getting a miscarriage. Then in the second half of pregnancy, there is a higher chance of getting gestational diabetes. There is a higher chance of getting high blood pressure in pregnancy. There's a higher chance of preterm labor. So you, even during pregnancy, you have to be careful about your lifestyle. You should not gain excessive weight. You should not be eating too much of sweet. You should follow the same lifestyle like you generally are advised for PCOD. And if you do not get these things, like if you don't get gestational diabetes, then the pregnancy goes on as normal and we are able to control it.
Sure. And I mean, you're beautifully presenting every question. It's clarifying very clearly. What do you think that how do you assess that it's a PCOD, and what are the tests which are available for these?
Okay. So, PCOS is a diagnosis which is not just based on an ultrasound or not just based on a blood test. It is an overall diagnosis. We have three criteria for diagnosing PCOS. One is an ultrasound showing polycystic ovaries, for which we have a criteria that if the ovaries are big in size and they have 12 follicles, then only we call it a PCOS. But an ultrasound is also not enough. You have to have some clinical feature, like you should have some period problem which is showing that you are not ovulating every month, so you are having delayed or irregular cycles. And the third thing is some male hormone excess issue like acne or hair growth or hair loss. So if you have two out of these three things, then we call you a PCOS.
Okay, okay. And since you have mentioned about all these symptoms and causes, how does it affect? I think is there any way which can which cure this for a lifetime?
So it can, see, the genetic problem, that is the genetic tendency, always stays with you throughout your life. You can control it with medicines or with lifestyle. And I have a lot of patients who I have treated and then they've gone to maintain it on lifestyle and they don't need any medicine throughout their life. So that situation can arise. But if your lifestyle goes bad, it can come back again. So you have to always control your lifestyle. If it goes bad, then we can give you medicines for 3 to 6 months to control it. But you cannot afford to just lose control over your lifestyle because it could come back again.
Sure. And how much time does it take, do you think, that this can be controlled, and this kind of timelines you should give it to yourself, that, which are minimum required for a
So
person?
usually if it's a period problem, we give medicines for about 3 months to 6 months, and it gets better if you've improved on your lifestyle. For weight issues, it really depends on what your original weight is and how much you're working on it and how much diet and exercise you're doing. We give medicines which also help in weight loss, faster weight loss, because in PCOS, weight is very resistant. It doesn't go and you get very demotivated. So it does help if we give medicines, but we aim that we give you medicines for about 3 to 6 months, but after that you should be coming back to lifestyle control.
So that is the major, giveaway, that they have to come back
Yeah.
and they have to focus on that. It's not the
Yeah.
only medicine which is going to do a magic, but they have to do something on themselves as
Yeah.
well.
Yeah,
Cool.
because you don't want to take medicines all your life. So.
Absolutely. So, my last question to you is that, do you think in a society women are quite aware about PCOD and such issues?
So I would say I'm in my practice, because we are in Gurgaon and most women nowadays are educated and they read up Google and everything. So they know too much about PCOD. Sometimes there are girls who don't have PCOD and they come to me that please check me. I think I have some acne here and there. I think I have PCOD. So everybody thinks they have PCOD. But people who do have it are aware, they do know what it is. There are some people who are coming in that marriageable age, like who are trying for pregnancy and not getting pregnant. when they are diagnosed with PCOD, sometimes they are not aware about it. But young girls, when they start getting period problems, then they're very actively searching about it on all the websites, and also they know what they have. So
Absolutely. I think they are aware that there's a term called PCOD and it is quite frequent, but they are not aware about the symptoms and what
yeah, that is
happens
true.
to get
Yeah, so
get the job.
the term is very common, but they don't know details about it. They don't know what it is actually. They don't know how to control it, and whether it's risky, because it's not a life-threatening problem. It's not. I wouldn't even call it a disease. It's basically a condition which you can control. But they are otherwise. They just know the term. They don't know details about it. That's true.
Sure. And is there any way, I mean, for which we can tell them that this is the time you should now get yourself checked? So you mentioned about the acne part. Anything else which is specific to it?
So if a girl is getting periods in more than 45 days or more than 35 days, if she's not getting periods in time, then she should see a doctor. If she's gaining weight, then and she's, despite her diet and exercise and everything, she's still gaining weight, or if she's having hair growth in the pattern that I've said, like in the male pattern hair growth, or acne which is resistant, then in those cases also she should visit a doctor. Um, of course, there are other situations when a woman is trying for pregnancy. They, anyways, if they're not getting pregnant, they do come to us. Uh, and if you do have a family history of, if your sister has come in time to check, get it checked.
Yeah, I can hear now. So, I mean, is there any, my last question to you is that, is there any, why do you think that it is so frequent these days? I mean, every second, third woman says that I'm going through a PCOS.
Yeah, yeah.
How
So,
come?
see, a lot of the reasons of PCOS are not very well understood. The genetic factors are not very well understood. But one thing I've really seen is that in metro cities we see a lot of PCOS, but in tier two cities, tier three cities, you will not see so much of PCOS. So it is
Right.
because of the lifestyle. It is because of the stress levels. It is because of the day and night shifts, the work stress, other kinds of stress, the lifestyle, the eating options, the because all those things do affect. And Abhi, recently in the lockdown, people who had PCOS, then they started having home cooked food, they started sleeping in time. So they actually cured their PCOS on their own. And there is also a set of people who became very depressed because they were lonely or isolated and all, and their PCOS worsened. So stress has a big role to play, and that is why yoga and meditation has a big role to play in PCOS.
Right. So the major learning of this session is that they have to maintain the balance between the diet and lifestyle, and that is the only key to, live happy and without PCOD. You can
True.
actually do whatever you want. Thank you so much, Dr. Asa. It was great having you here, and it was a great topic because a lot of people were sending requests to talk about on PCOD, and we have picked up this session. I'm sure a lot of people would see this after we upload and publish this session. Thank you so much.
Thank you.
Thanks for
Thank
your
you
time.
so much, Richa. Always a pleasure.
Thank
Okay.
you so much.
Okay. Bye.
Bye. Bye.